Hello everyone, it's Dr. Nikki, the board-certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. In today's new podcast episode, I will be talking about two common sexually transmitted infections, chlamydia and gonorrhea. Chlamydia and gonorrhea. Chlamydia is a very common STI, and it's an infection that is common in both men and women. It can actually cause damage, permanent damage to a woman's reproductive system if care is not taken. All right, so let us go into how you can get chlamydia, what the risks are, and how you can treat it, okay, or prevent it, okay? All right, so as I said before, chlamydia can damage a woman's reproductive system. It can cause ectopic pregnancy. It can lead to infertility. If care is not taken. How is it spread? It's spread through vaginal, oral, anal sex with someone that has chlamydia. It's caused by a bacterium. All right, both chlamydia and gonorrhea, they're caused by bacteria. All right, so you can have chlamydia through vaginal, anal, oral sex if you engage in sexual intercourse with someone that already has the disease or the infection. Okay, and you can actually transfer the infection to your baby during childbirth if you're pregnant and you're not treated. Okay, so how do you reduce your risks of getting chlamydia? If you're sexually active, you have to be very careful. All right, you have to be very careful. Limit your sexual partners. You have to have a monogamous relationship, and please let your partners get tested. You and your partners, you can get tested. All right, make sure that you are mutually exclusive to each other and that you use protection. Use condoms. All right, use condoms the right way whenever you're having sex, and please limit your sexual partners. All right, if you're a risk for chlamydia, if you engage in high-risk behavior, sexually, you will be at higher risk of getting chlamydia. This is due to different behaviors because we do have people that engage in a lot of sexual activities out there. We have bisexual men, we have gay, they're also at a higher risk of getting STIs, okay? So please be very careful. If you're sexually active, be honest and open with your partners and your healthcare team as well. Get tested for chlamydia and other STIs, all right? Sexually transmitted infections, okay? If you're also pregnant, you should be tested for chlamydia as well, okay? And most women, they do not even know they have chlamydia unless maybe when they're pregnant and they go for testing and they find out that they have chlamydia. All right? And you really need to take care of yourself. So please get tested for chlamydia every year. If you are younger than 25 years old and you are sexually active, okay? Or if you're 25 years old and older and you have risk factors such as multiple sex partners or new sex partners, or you have a partner that has a sexually transmitted infection. And remember, whenever you have a sexually transmitted infection, please do not engage in sexual intercourse. Make sure that you're treated and you're well, and make sure that your partners are also treated and they're well. Follow your doctor's orders, follow your healthcare provider's recommendation about when you can resume sexual intercourse. All right, so as I said before, if you're pregnant and you have chlamydia, you can give the infection to the baby during delivery, and that's why it's very important that you get tested and treated. This can cause an eye infection or pneumonia in your baby, and having chlamydia may also cause premature delivery. It increases your risks of delivering your baby early. So please receive testing at your prenatal visit. Talk to your healthcare provider. Do not hide anything from them, and they will do the necessary testing for you and give you the necessary treatment as needed. Okay. As I said before, some people do not know that they have chlamydia. Some people do not have any symptoms, but it can cause very serious health problems even without symptoms. So, as I said, please make sure that you take care of yourself. If you do have symptoms, it might be abnormal vaginal discharge or a burning sensation when you urinate. Okay, for women. For men, you may have burning sensation also when you urinate or discharge from your penis. All right, and you also can have pain and swelling in one or both of your testicles, but this is less common. Okay. Please also watch out for any bleeding, abnormal bleeding, discharge, or rectal pain. If you have any other issues like a smelly discharge, unusual sores, burning when urinating, or bleeding between periods, please follow up with your healthcare provider so that they can do appropriate testing for you and get you the right treatment. All right. So, as I said before, testing is needed. You will be diagnosed with chlamydia if you get tested and it's positive. They will let you know, and the right treatment is needed. And you can also tell your partners to get treated as well. So you should not engage in sex again until you and your partners are being treated and you've completed your treatment, as I mentioned before. Sometimes it's only like a single dose of medication that you need, and then you need to wait about a week after taking the medication before you can engage in any kind of sexual activity. All right. If you do not get treated, you can damage your reproductive system. You can. So please. Most times when you have chlamydia, the doctors will treat you also for gonorrhea. It tends to go hand in hand. So most times when you're treated for chlamydia, they will also treat you for gonorrhea as well. All right. So now let us go and talk about gonorrhea. Okay, gonorrhea is also an STI, sexually transmitted infection. It affects the rectum, the genitals, and the throat. Okay, it's very common actually, and you will be surprised that it's very common in younger people. Okay, it can cause an infection in your genitals, the rectum, and your throat, as I said before, and it's very, very common. So you can also get gonorrhea, as I mentioned, if you have vaginal, anal, or oral sex with somebody that has gonorrhea. Okay, if you're pregnant and you have gonorrhea, you can give it to your baby as well during childbirth, and that's why it's important for you to be tested and be careful and get the appropriate treatment. Okay, the ways that you can completely avoid getting any kind of STIs, STI, sexually transmitted infection, or sexually transmitted disease, is that you do not engage in sex. All right. Don't have any kind of sex, anal, oral, vaginal, don't have any. But if you do, if you're sexually active, there are things that you can do to lower your risks of getting sexually transmitted infections. Being in a monogamous relationship, as I mentioned before, and using protection the right way. All right? Using condoms the right way. Okay. If you are sexually active, as I mentioned before, be honest with your partner. Be honest with your healthcare provider about your partners, the type of activities that you engage in, because they'll be asking you a lot of questions, okay? Tell them to test you for gonorrhea or other STIs, chlamydia, as I mentioned before. Some people are at higher risk of getting all these disease infections than other people. So if you're bisexual, if you're gay, just be honest and open with your partners and your healthcare provider so that we can appropriately help you and get you the right treatment. Okay? you should also get treated or tested for gonorrhea if you're younger than 25 or older than 25 and you have risk factors such as multiple sex partners, or you have a partner that has had a sexually transmitted infection. Okay, and as I said before, when you're pregnant, that can affect your baby. You have to be very careful. You have to be very, very careful. All right, so please watch out for burning sensation when you urinate, white, yellow, or green discharge from your penis, and painful or swollen testicles. All right, also watch for burning sensation when you urinate as a woman, increased vaginal discharge, bleeding between periods, soreness, bleeding, painful bowel movements, discharge. Let your healthcare provider know. They can do the tests and then give you the right treatment. Okay? Yes, the right treatment can cure gonorrhea, but it's important for you to open up and let a doctor know what's going on with you. Okay? Do not share your medication with anyone. If you are treated for chlamydia or gonorrhea, you should also let your partner be treated as well. Okay? So make sure that you finish all your medications even if you feel better. All right? Finish all your medications even if you feel better, and then listen to your doctor's advice on when to return to having sexual intercourse. Okay? Do not engage in sexual intercourse while you're actively infected with gonorrhea or chlamydia. Okay? All right, so make sure you take all your medications and make sure all your symptoms are gone. Okay? Because remember, if you do not get treated well for your STI, it could lead to infertility, and you do not want that. It could damage your reproductive system, and you do not want that as well. So please remember, prevention is better than cure. Prevention is better than cure. But if you do not want, if you can prevent or avoid sexual intercourse, then you need to protect yourself by using protection. Okay? Using protection. Prevention, no sexual intercourse, anal, vaginal, oral. But if you can't, then you should protect yourself. Okay? Remember, as I mentioned before I round up, gonorrhea and chlamydia, they are caused by bacteria. Okay? So you receive medication and antibiotic, and you should be okay. All right? So CDC has a guideline on the treatment, but I will let you just go and get yourself tested and treated by your doctor. Okay? So take care of yourself. Make sure that you stay in a monogamous relationship and you use protection. All right? I will catch you in the next one, and I hope you can share this episode with friends and family. STIs, they're nothing to be joked about. They're very, very common, and they are very important. It's very important for you to be treated and tested and treated. Okay? They're very common, but we do not want you to suffer in silence. So open up to your healthcare provider, get the necessary tests done, and get the appropriate treatment. All right, well, thank you so much, and I hope you enjoyed the episode. I will catch you in the next one. Remember, continue to stay well, be safe, and I'll talk to you later. Bye-bye.